Introduction medical students, today I will be discussing a comprehensive overview of menopausal symptomatology and the rationale for hormone therapy. Menopause is a natural process that occurs in women typically between the ages of 45 and 55, resulting in the cessation of ovarian function and a decline in estrogen production. This hormonal change leads to various physical and psychological symptoms, impacting women's quality of life. End of introduction. During menopause, women may experience a myriad of symptoms including hot flashes, night sweats, vaginal dryness, mood swings, sleep disturbances, and bone loss. These symptoms are primarily attributed to the decline in estrogen levels. Hormone therapy, HIT, aims to alleviate these symptoms and improve overall well-being. Existing evidence suggests that HIT can effectively manage vasomotor symptoms such as hot flashes and night sweats. Additionally, HIT can help prevent postmenopausal bone loss, reducing the risk of osteoporosis and fractures. The decision to initiate HIT must carefully consider the severity of symptoms, individual patient characteristics, and potential risks and benefits associated with therapy. End of topic 1. When it comes to hormone therapy, clinicians have the option of prescribing estrogen-only therapy, ET, or estrogen progestogen therapy, EPT. ET is commonly recommended for women who have undergone hysterectomy, as there is no need for progestogen to protect the uterus. On the other hand, EPT is indicated for women with an intact uterus to prevent endometrial hyperplasia and lower the risk of endometrial cancer. Progestogens, such as medroxyprogesterone acetate or micronized progesterone, are commonly used in EPT to counterbalance the proliferative effects of estrogen on the endometrium. The choice between ET and EPT should be individualized, considering patient preferences, medical history, and risk factors for estrogen-related complications. End of topic 2. Understanding the pharmacokinetics and pharmacodynamics of estrogen and progestogen preparations is crucial for optimizing hormone therapy outcomes. Estrogen is available in various forms, including oral tablets, transdermal patches, gels, and intranasal sprays. Estrogen's systemic effects depend on its route of administration. For example, oral estrogen undergoes first-pass metabolism in the liver, leading to increased production of clotting factors and potentially impacting cardiovascular health. In contrast, transdermal estrogen bypasses the liver, offering a safer alternative. Progestogens, on the other hand, can be administered orally, intravaginally, or through intrauterine devices. Understanding the different absorption rates, bioavailability, and duration of action of these preparations aids in tailoring hormone therapy to individual patient needs. End of topic 3. Hormone therapy can be administered through various routes, each with its advantages and disadvantages. The most commonly used routes are oral, transdermal, and vaginal. Oral hormone therapy is convenient but has an increased risk of venous thromboembolism, stroke, and liver dysfunction due to the first-pass effect in the liver. Transdermal administration, in the form of patches or gels, bypasses the liver and may be a safer option, especially in women with cardiovascular risk factors. Vaginal hormone therapy, such as creams or rings, is primarily used for localized symptoms like vaginal dryness and discomfort. The choice of route depends on individual patient characteristics, treatment goals, and risks associated with each route. End of topic 4. Estrogen plays a vital role in relieving menopausal symptoms, maintaining bone health, and influencing cardiovascular health. It exerts its effects through estrogen receptors found in various tissues, including the central nervous system, bones, and blood vessels. By targeting these receptors, estrogen alleviates vasomotor symptoms, improves mood, and enhances cognitive function in women experiencing menopause. Estrogen also helps maintain bone density by inhibiting osteoclastic activity, thereby reducing the risk of osteoporotic fractures. However, the effects of estrogen on cardiovascular health are complex and context-dependent. While estrogen initially was thought to have cardioprotective effects, subsequent studies have raised concerns regarding its potential association with increased cardiovascular events in specific subpopulations. Therefore, careful consideration of cardiovascular risk factors and individual patient characteristics is crucial in determining the appropriateness of hormone therapy for cardiovascular management. End of topic 5. In women with an intact uterus, the addition of progestogens to estrogen therapy is essential to ensure adequate uterine protection. Unopposed estrogen therapy increases the risk of endometrial hyperplasia and endometrial cancer. Progestogens counterbalance the proliferative effects of estrogen on the endometrium, thus reducing the risk of malignant transformation. Commonly utilized progestogens include medroxyprogesterone acetate and micronized progesterone, which can be administered orally, intravaginally, or through intrauterine devices. Clinicians must individualize hormone therapy by considering patient preferences, tolerability, and adherence to ensure optimal uterine health during treatment. End of topic 6. Hormone therapy should be individualized to meet each patient's unique characteristics, preferences, and needs. Factors such as age, menopausal status, presence of comorbidities, cardiovascular risk factors, and personal preferences should guide treatment decisions. For instance, younger women experiencing premature menopause may require more prolonged hormone therapy to ensure long-term bone health and symptom relief. In contrast, older women with established cardiovascular risk factors might need a cautious approach due to potential adverse effects. Shared decision-making between the patient and the healthcare provider is crucial to ensure that the selected hormone therapy aligns with the patient's goals and minimizes potential risks. End of topic 7. Hormone therapy is not without risks, and clinicians must carefully evaluate the potential benefits against the risks associated with treatment initiation. Some of the commonly discussed risks include an increased risk of breast cancer, venous thromboembolism, stroke, and cardiovascular events. Breast cancer risk assessment plays a crucial role in determining the appropriateness of hormone therapy. Women with a history of breast cancer or those at high risk due to familial predisposition might need alternative strategies for menopausal symptom management. Clinicians should discuss these risks comprehensively with their patients, taking into account individual patient characteristics and preferences, to make informed decisions regarding hormone therapy. End of topic 8. Though hormone therapy offers considerable benefits, side effects and complications can occur, necessitating effective management. Common side effects include breast tenderness, bloating, breakthrough bleeding, and mood changes. These can often be resolved through dose adjustments, changing the route of administration, or switching to different preparations. Serious complications, such as venous thromboembolism or cardiovascular events, require immediate attention and potential discontinuation of hormone therapy. Monitoring for these complications is crucial, and patients should be educated on the signs and symptoms that warrant prompt medical evaluation. Clinicians must foster open communication with patients, addressing their concerns and promptly managing any side effects or complications that may occur. End of topic 9. Monitoring and evaluating the effectiveness of hormone therapy is essential to ensure optimal patient outcomes. Patients should be assessed regularly for symptom improvement, bone health maintenance, and overall well-being. Clinicians should individualize the follow-up schedule based on patient characteristics, treatment goals, and specific therapy regimens. Laboratory investigations, such as bone mineral density measurements, lipid profiles, and blood pressure monitoring, may be necessary to assess treatment response and identify any therapy-related complications. By closely monitoring patients, healthcare providers can make timely adjustments to hormone therapy, optimizing outcomes and mitigating risks. End of topic 10. Various healthcare organizations and expert panels have developed guidelines and recommendations to assist clinicians in making evidence-based decisions regarding hormone therapy initiation, duration, and discontinuation. These guidelines consider factors such as age, symptom severity, individual patient characteristics, and potential risks. Shared decision-making, where patients actively participate in treatment decisions, is highly encouraged. Detailed assessment of the potential risks and benefits associated with hormone therapy should guide the prescribed treatment duration. Generally, hormone therapy should be prescribed at the lowest effective dose for the shortest duration required. Discontinuation of hormone therapy should be done gradually, with careful monitoring for rebound symptoms or potential complications. End of topic 11. While hormone therapy is highly effective for managing menopausal symptoms, some women may opt for non-hormonal alternatives or complementary therapies. These alternatives include selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, gabapentin, and clonidine, which have shown efficacy in managing vasomotor symptoms. Complementary therapies, such as mindfulness-based stress reduction, acupuncture, and herbal remedies, remain popular among women seeking natural approaches to symptom management. However, the evidence supporting these therapies' effectiveness is variable, and caution should be exercised when recommending them. Clinicians should engage in open discussions with patients, exploring their preferences and expectations, and provide evidence-based guidance on non-hormonal alternatives and complementary therapies. End of topic 12. In conclusion, hormone therapy remains an integral part of managing menopausal symptoms and promoting overall well-being. Clinicians should consider individual patient characteristics, preferences, and risks associated with therapy when making treatment decisions. Regular monitoring, evaluation, and open communication with patients are essential for optimizing outcomes and mitigating potential complications. Non-hormonal alternatives and complementary therapies can also be explored for women who prefer non-pharmacological approaches. Ultimately, a comprehensive and personalized approach is necessary to ensure the highest quality of care for women experiencing menopause. End of conclusion.